Good morning, everybody. Thank you so much for joining us today. We are so excited as new student and family programs to get you connected to some wonderful folks in health and wellness, as well as our student conduct office, and share with you just more ways that you can be a partner both with campus and, of course, how we want to support you in helping your student. My name is Lizzie Brister. I'm the Assistant Director for New Student and Family Programs. This is our office. None of us are there right now, but this is how it used to look in the day before some of our lifestyles shifted this year. But I did want to throw up our contact information so that you can, at any time, get a hold of us. We really want to share this information with you live as we're doing right now. But then, of course, as you continue to have questions and you have more individual cases with your student, you want more individualized answers, we of course want to support you. So we've got our professional staff as well as our student leaders in our office who can answer your call or text to the number you see there, as well as you can email us. And then of course you can browse our website. We have Bree, my colleague Bree is going to be showing some of our resources we have online as well to help with stuff. A couple housekeeping items. I do want to point out that at the bottom of your screen, if you hover over the bar, you should be able to see both a Q&A feature as well as a chat feature. And just want to let you know that we will be using the Q&A feature to answer your questions. The chat, as you may notice, or you've experienced on Zoom before, as people comment, we aren't able to go back up and address a specific person's question. It kind of can get lost in the list of the history of the chat. So do use that Q&A feature because that'll allow us to go right back to your particular comment and respond to you. So I do just want to, again, please use that Q&A chat feature. And then we should have some time at the end of this presentation. We'll take some time to answer what we're seeing, our common questions, as well as let our panelists answer those since they have a little bit more expertise in some of those areas. So again, there's me, I'm Lizzie, and then I do want to turn it over to Judy Waterman.
Thank you so much, Lizzie. Good morning, families. Thank you so much for joining us. We wanted to kick it off with just showing you some of the things that new student and family programs offers for families. So the first one is what are we doing for our new Buff family? So on our website, if you have not been here before, we just wanted to show you how you can get to our website. And then since you're already in this webinar, hopefully you've also heard of our coffee hours and you'll see our webinar series here. I also wanted to show you all the Buff Family Resource Hub. This is a great place for families to stay connected and learn more. I know sometimes the CU website can be difficult to navigate, and we typically will Google CU Boulder and then the item that we're searching for, or we'll use this Buff Family Resource Hub as a central place to start us in directing families to resources. So if you're looking for information on finances, you can click the tiles based on topic. And for example, this one tells you more information about how you can become an authorized payer for tuition and fees if you're looking to know how to access the bill or wanting to see the cost webpage. So really wanted to make sure that you all knew that this Buff Family Resource Hub was a resource because sometimes it's kind of hidden and families might not realize that it's there. So check out on New Student and Family Programs, the Families tab for lots of great resources. Wanted to highlight that, and then also wanted to highlight our Buff Family newsletter. So we may or may not have your email based upon if your student put it in their application process when they applied with our Office of Admissions. And if they had a typo or maybe used your old email address, you might not be on our email listserv. So you can always go to the Buff Family newsletter and click sign up and give us your information so you can make sure you're on the list. Here you can also see some archived newsletters. So if you missed one, you can also check those out there. And then for our new Buff families, you're receiving a separate email called Boulder Bound. because we know you have specific needs as a new Buff family. So again, if you have not seen these Boulder Bounds in your inbox, they are on this new Buff Families website right here in the corner, Boulder Bound Family Newsletter. You can see all of the archived Boulder Bounds here. Hopefully that's helpful for you all so you can navigate back here and look and explore our website a little bit more yourself. And then I always enjoy this part of our webinars. We are really curious who is joining us today in this Zoom room. So I'm going to launch a quick poll so we can see who's all joining us. So you'll see this come up on your screen. And we want to know, are you an in-state, out-of-state, or international family? Is this your first student in college? Is this your first student at CU Boulder? And then, is your student a first-year transfer or returning student? We'll give everyone a few minutes to go ahead and fill out those poll questions. Wonderful. So keep on voting and answering the poll as you enter. But I'm seeing right now we have slightly more out of state than in state. We have a few international families joining us. Welcome. A lot of you, this is your first student in college. And then a lot of you, this is your first Buff in the family. So welcome to CU Boulder. And then most overwhelmingly first-year students, which we see that a lot. We also have some transfer families joining us. So I know, welcome to CU Boulder as well. This will be your second institution, so welcome. So I will go ahead and close the polls for now. And if you are just joining us, a reminder to use the Q&A feature, and we will answer those as we can, and there will be open Q&A at the end. I always like to show one more additional research or additional resource for you all if you aren't aware of the roadmap to fall 2020 plans and the website www.colorado.edu/coronavirus. So these websites are very helpful for families and students to dive into a little bit more and really explore and read things for yourselves. And I think making sure that everyone is aware that these are being updated and will always have the most up-to-date information. You can also see the health and safety measures here, the implementation timeline, and the modes of operation. So if you didn't know about the roadmap yet, we wanted to make sure that you did, and then we'll be getting ready to turn things over to talk specifically about health and safety and how that impacts our students and how that will be enforced. There's also a lot of housing and move-in questions right now. So if you haven't seen the housing FAQ guide or the move-in FAQ guide, I wanted to make sure you all were aware of these as well. So if you're wondering, when is move-in? Will I be able to change my move-in appointment? All of these questions have little plus signs next to them that you can dive in more to all of the most frequently asked questions. In addition, the move-in resources tells you things about how to prep for move-in, the move-in schedule and instructions, and then the move out and break information. So if you're wanting to know more about the schedules or the drop-off days, that information can also all be found here. If you're having trouble finding these links, I'm sure some of the NSFP staff can send them in the chat so that you all can resource them, find them, and be able to click them on your own. And also, go ahead, we are a resource. Email us or call us. If you do have other questions, we're happy to make sure you get these links.
Thank you so much, Bree. So our office really does exist to help new students make it through this transition and get settled on campus, figure out both just where everything is that they need on campus, as well as who to contact for what. And we exist as that resource for you too. So as Bree said, don't hesitate to reach out to us. We are very quick to answer email. We have our phones staffed from business hours Monday through Friday. And so don't hesitate to reach out. We will help you sort out exactly what you need, especially if you have a more individualized question about your student. Um, and truly, we want to be there to help you figure out what the best way to support your student is. And so we've got a step-by-step guide on our new student and family programs website, which is very similar to the checklist that your student has in their student portal. You can click on either transfer, first year, or international. There's some slight differences just with the timeline. But for example, it looks like we're clicking on the first year student tile. It's got these steps here. So at this point in the summer, we're hoping that your student has completed a bunch of these. But if you want to double check, if you want to know what they're being prompted to do, you can follow along here as well. All the way down, there's several online modules they'll take, as well as then it's got information about move-in and the fall welcome experience when your student gets here. Because we truly know how much impact parents and family have on their students' success. Students look to their family to help them make these big decisions. They look to you for advice. And we know how important it is for you to be well informed and able to support them in that. So one of our biggest pieces of advice is simply to encourage your student to check their CU email, because we are prompting them to do the next steps. They're getting valuable information about housing or about their classes from their advisor. Everything's going to that CU email address. So if anything else, if you walk away with anything else, just direct them to be checking that email regularly. Next slide does say just a little bit more about our philosophy of families as partners. And so we know that the university starts treating your student as a fully fledged adult, whether or not you may feel they're ready or they may be ready to step into that position and assume that responsibility. And so we want to help you support them as that passenger seat assistants. They're behind the wheel, but you are there to help them figure out how to drive that car. So we thank you so much for joining us today. And I am excited now to get to turn this over to Leisha Connors-Bauer from Health and Wellness to share more about everything that's changed for this fall. So Leisha, welcome.
Thank you, Lizzie. I just wanted to share a quick overview of what Health and Wellness Services at CU Boulder encompasses. In this list that you see on this slide here are the departments that are located in Health and Wellness Services. And the focus of Health and Wellness Services is to support student health and well-being so that they can be successful during their time at the university. And that can happen in a variety of ways, through counseling services, through recreation services. In my office is health promotion, which really focuses on that health education aspect. And so we recognize that there's a link between health and academics, and so really try to focus on providing students with the skills and tools that they need. I also want to talk to you a little bit more about what some of the things we're focusing on for the next academic year. You can go ahead and next slide, Bree. So some of the things that we're working on are the prevention piece, and really focused on different types of recommendations and reinforcing skills that can help students stay healthy. We talk to students a lot about managing stress and managing their sleep, since that can really impact their immune system and make it easier for them to get sick in different ways. We've seen that cold and flu has a big impact on their academics, and we know that this experience with COVID-19 has been really stressful for everyone, and really thinking about what are some of the ways that students can help navigate those circumstances. Testing is a big question. We're really working on implementing off-campus testing for students. I think that will mean there's a quicker turnaround time. We're hoping to be able to start testing our testing protocols at the beginning of August. once we get that in place, I think we're looking at being able to get test results back the same day, which will be really helpful in a lot of different circumstances. One of those circumstances that I think it will be most helpful for is we're also putting workflows together regarding contact tracing and case investigation. You may have heard about some of this on the news, and it's a really important piece in terms of trying to contain or mitigate disease spread. And so what we're looking at doing is we were working really closely with Boulder County Public Health, and then to serve as an adjunct for the local public health agency, we'll be doing the case investigation. So if we get notification from Boulder County Public Health that someone has tested positive, we will contact that person, assess their symptoms, make recommendations about isolation and quarantine, find out who they have been in close contact with. And we're defining close contacts as someone who has been within 6 feet of someone for 15 minutes, for at least 15 minutes. And then we will follow up with those contacts, make recommendations for them to get tested, to go into quarantine, what quarantine looks like, and what support can be provided for students. There will be some isolation and quarantine spaces available for students who are living on campus in different dorms. And so those are the current things that we're planning on. And then we will also have a public health clinic that will be separate from the regular health clinic in Wardenburg Health Center. And the focus of the public health clinic is really where the testing will take place. For students who are showing symptoms of COVID-19, they will go to public health clinic. And then preparing for campus arrival. I think that students should have received a new student checklist that talks a little bit about some of the things that they will need to complete. There's an insurance verification, vaccines. There is also the checkup and traces well check that students will need to complete if they haven't. We just launched yesterday a Canvas course. And then we run into a little bit of a glitch with the Canvas course in that the completions were not automatically uploading as quickly as possible. They're working on fixing that. I also wanted to clarify with any of you, if you have students who've completed the Canvas course and they are worried about it impacting their course registration, the hold will only impact their registration if they do not complete the course by August 1st. So students who have registration windows that are open at this point in time, between now and August 1st, they will still be able to register. We're asking all of the students to complete the course prior to campus arrival. And part of that is because we've given an overview of the virus and how the virus spreads. We talk about those protective behaviors that everybody's seen about face coverings, physical distancing. What are some of the cleaning guidelines? There's recommendations in there for what to do if a student feels sick, who to contact. There's recommendations for mental health and how do you get support. There's also a little bit about the campus expectations and references to the changes in the code of conduct that Daniel will be talking about a little bit later. And then the daily health questionnaire. Students, currently faculty and staff who are headed to campus and will be physically on campus are being asked to take a daily health questionnaire. Students will be being asked to do the same thing as well. And it's pretty simple in that it's just a question of how are you feeling today? Do you have any of these symptoms? And it will give students either a green smiley face or a red frowny face. If a student isn't feeling very well or they click on any of the symptoms that are associated with COVID-19, they will get a recommendation on who they need to contact. They will also be recommended to not go to class that day. And then again, the social and physical distancing piece. Campus will be marked in a lot of places where there will be what that 6 feet guideline looks like. That will be reinforced throughout the campus through signage in different places. I think one of the challenges is that social distancing piece. Gatherings will be limited to 10 or under. And so I know that's going to be really tricky for students who are looking forward to making friends and having different experiences when they're here. I think the other piece in terms of the social distancing is really encouraging their students to get support for that. There's ways in which they can connect online or virtually or within their own cohort so that students don't feel isolated. And then also a reminder for students not to share their personal items. That may be things like not sharing lip balm, not sharing cups or drink containers or vapes or other things that are personal to them. And I think the last thing I wanted to share with you is how students can seek support and access services on campus. The website, colorado.edu/health, has all of our current information and links to all of the different departments on campus. So you can see there's a button for updates regarding COVID-19. There's information about if services have been impacted, and then all the health and wellness updates related, and then a direct link to the campus coronavirus updates page. And then also, I wanted to share with you that we have a 24/7 counseling support line. You can access counseling and psychiatric services staff during the business day at this number and at the 492-2277 number. And then if it is after hours, that will still be answered if someone needs counseling support. And similarly with a 24/7 nurse line, that will go to the clinic during business hours, but it will be answered by a nurse after hours as well, so that students are able to access those supports. And I think the other piece that Daniel will talk a little bit more next is what some of those social gathering and other requirements will look like from a student conduct perspective.
Thank you, Alicia. I will go ahead and turn things over to Daniel, and then we also are keeping up with your Q&A, and we'll be able to answer some of the common questions at the end aloud as well.
Great. Well, first I want to say welcome to the CU community. We are really happy that you all are here today to learn more about our campus and what we're doing to support folks, because I really think you all as families are going to play a crucial role in helping our communities be healthy and safe this year. And so I've been kind of watching the Q&A. There's a couple questions about student conduct policy. I'm hoping I'll answer all those, but certainly we'll have time for questions at the end as well. So my name is Daniel Easton. I am the interim director for the Student Conduct and Conflict Resolution Office. And just to kind of give an overview of what our office does is that we provide individual responses in response to issues around community standards and conflict resolution. And that we really focus on emphasizing accountability through an educational process by reflecting on the impact of behaviors, about a student's role in their community, their values, their identities, encouraging folks to repair harm when harm is caused, and ultimately cultivating the well-being and safety of our community. And really these values are driving not just what our policies are, but how we're responding to policies related to COVID, alcohol and drugs, and we'll go over that a little bit more specifically. Our office does also oversee a couple other services on campus related to academic integrity. You can click on that, Bree, that we can see. We oversee academic integrity. We have a restorative justice program. I'll be focusing today on student conduct and conflict resolution for the purposes of our topic, but feel free to visit our website. It has an overview of how we run our process and what our policies are. So if we want to jump back to the presentation, our contact information is at the bottom of that slide as well if folks want to reach out to us. So if we jump to the next slide, the first policy I want to talk about is the campus COVID-19 health and safety policy. This was put into place on June 23rd. We've updated the code of conduct to really reflect what those expectations are for all students. And I think when we think about this policy, we'll get into the specifics of it in just a moment, but I think the intention of this policy is to help keep our campus healthy and well, right? And so every individual, including staff, faculty, as well as students, will have a responsibility to help keep our campus safe and well. And these policies are intended to provide guidance and requirements for what students will need to do to play their role in that. And so the specifics are that first is that the city and county of Boulder does put in sort of specific public health orders, and that students are expected to follow those those public health orders when they're on or off campus. And so it's not just a campus policy, but also if someone is off campus and not following a public health order, that would be something that our office would look into and would receive reports about. The Code of Student Conduct does include links, and that page that we just visited does include links to the Boulder County Public Health website for students to learn about those orders. Broadly, it matches what the policies that we have on campus in place. So what I talk about today should be what is good information to start with your student. Leisha talked about physical distancing. The policy on this is that students are expected to maintain a physical distance of 6 feet when it's possible, right? So, you know, we're a big campus. We know that there may be points where like a specific 6 foot sort of distance, you know, may not be sort of feasible just as we're moving folks around, but whenever possible, folks need to be maintaining that 6 foot of distance, or if they're not able to, they need to get out of the situation, remove themselves from a situation so that they are able to maintain that 6 foot of physical distance. Connected to that is one of our policies around masking, and it is that if students cannot maintain a 12-foot physical distance from individuals, that they need to be wearing some sort of cloth covering or mask that covers the nose and mouth while they're doing that. And so I think that, you know, there's that sort of physical distance requirement. Generally, you should probably talking to your student about always having a mask with them at all times so that they are able to put on a mask when they need to wear a mask. And we'll talk a little bit about sort of like accommodations, because I'm saying there can be sort of specific disabilities that may limit the ability to wear masks. If folks do need to request accommodations, they should contact our disability services office, and they will review the student's needs and what accommodations need to be put into place for the support of your student. Additional information about this policy, guests and visitors. I know this came up in the Q&A in the residence halls. It is the case that students, let's say your student is assigned to live in Baker Hall. Students who do not live in Baker Hall are not permitted to be present in Baker Hall. They can come to the lobby to maybe meet up with a friend if they're going to go somewhere else, but they will not be permitted into sort of the locked areas behind the lobby. That is to sort of like provide some distance and to prevent sort of cross movement from various residence halls. When it comes to visitation policy within the residence hall, students are allowed to have visitors in their private room if those visitors do live in that residence hall. The limitation on that is that they can only have the number of visitors, they can only have visitors in the room that would match the number of people who are currently assigned there. So let's say there's 2 people who are assigned to live in a room in Baker, they can have 2 visitors present in their room. Or they can utilize some of the public spaces to sort of like visit and socialize, as long as they're maintaining that physical distance and not gathering with more than 10 people. And then lastly, around campus, there's different needs that the various buildings will have when it comes to maintaining physical distance. And so if there are posted signs, so for example, if they go to the dining hall and there's sort of 6-foot markers to keep in line so that folks aren't standing too closely together in line, folks need to comply with those posted signs. And then faculty members will also be setting specific policies for their classes around physical distancing and masking, and students will need to follow what the expectations of their classes are. So that's a lot of policy language and what's expected. And I think one of the things that we recognize is that with this policy specifically, the sort of like culture of what folks expect from their college experience is very different than what the fall is going to look like. And that is why we really want to focus on education first. So Leisha had talked about some of the proactive education we're providing, and even in cases where someone isn't following these policies, for early cases, we're going to be starting with providing education and support to the students. They can understand why it is crucial that they comply with this policy. And as part of this, we do see you as partners in this, right? Because one of the things that will help students see the importance of following this is if they're getting the message from multiple sources that are important to them, saying that, yes, it is important that you do this because it is going to be, for us to have a successful year is that students, faculty, and staff all have to play their part in living up to these standards. And so we are encouraging you to have some of these conversations even ahead of time to help your student think about what would they do in a circumstance if a friend isn't wearing a mask, or if they are trying to figure out whether they should physical distance or not. Like if they can help think about that now, that will help them come move-in day, come that first week, come October, right? When things have sort of settled into a norm. Like doing some of that reflection now is going to be really important. We are encouraging participation in contact tracing. And one thing I want to be really clear about with that is our office would not have access to information shared during contact tracing. So if a student says, hey, I was at a gathering of more than 10 people as part of talking to a contact tracer, that will not be reported to our office. And the reason is that we want folks to give honest information so we can have an accurate process for tracing a virus. So that information will not be shared with us. And even if we became aware of information that was shared as part of contact tracing, our office would not take disciplinary action on that, because again, we don't want to create a circumstance where students are disinhibited from wanting to provide accurate information as we are as a campus taking steps to make sure we're healthy and safe. Let's go to the next slide because I want to talk about some other policies as well. First, I want to talk about a sort of alcohol and drugs policy. And really our approach to this is, one, our policy does apply both on and off campus, and we do have a partnership with Boulder Police that they will routinely send us police reports for students who are violating our alcohol and drug policy. Alcohol and marijuana cases are the majority of conversations we've had historically. And again, our approach to this is that we want to be educational, right? The policy is there of like, if you're under 21, you can't possess or use alcohol or marijuana. And at the same time in our meeting, we want folks to be able to to reflect on, again, what are their values? What are their goals? How do their decisions help them achieve those goals? And if they choose to use substances, using research-backed sanctions to help them make safe decisions if they decide to use those substances. Additionally, that can also result in an informal resolution where there isn't like a formal disciplinary record in cases where students, for their first time, and if they're sort of like reflective and honest about what's occurred, our intention is to, again, provide a space for reflection and education so that students can make safe choices for themselves. I do want to address medical marijuana because this is something that comes up a lot, is that because we're a federally funded institution, we're actually not allowed to have medical marijuana on campus for any purpose. And so possession and use of medical marijuana for anyone is not permitted. Similarly, even if someone is of the age of 21, they are not permitted to have marijuana on campus because the federal government has not recognized recreational or medical marijuana as legal. So, and since we receive federal funding, our policy is that that is not allowed to be on campus. I also want to talk about our amnesty policy, and Bree, can you click on that link? This is really important because we understand that students may be in situations where their friend is facing an alcohol or drug emergency. So maybe they consumed an edible marijuana brownie and they're having a bad reaction, right? Or they consumed alcohol to a point where someone is non-responsive. And we don't want students to be afraid of getting in trouble if they call for help. And that is why we have this amnesty policy. So if someone is worried about someone and they call for help, so if they call for an RA, if they call for medical staff, if they call for police, if they stay with the person who needs help and they cooperate with folks when they arrive to give help, neither student is going to be subject to any sort of formal disciplinary record. For folks, if they do require medical attention, we will require some type of alcohol drug education because, again, we want them to make safe choices if they're going to decide to use these substances. But that ultimately we don't want folks to fear calling for help and getting in trouble, that we want folks to do the right thing. And if someone is in need, that they do call for help. This policy will also cover COVID-19 related violations. So let's say that someone's at a gathering of more than 10 people and like they call for help because someone consumed too much alcohol. We would still apply this policy even if there was a violation of a public health order or a COVID-19 mitigation policy, because again, we don't want folks to be afraid of getting in trouble if there's someone whose safety and well-being is at risk. Let's go ahead, we can jump to the next slide. I do want to talk about, I did reference that Boulder Police, we have a relationship with them where they will submit police reports and citations to our office, and we will meet with students for violating our policies off campus. The most common referrals that we receive are what's called minor in possession of alcohol or marijuana. In the state of Colorado, something to know is that when it comes to possession of alcohol or marijuana, your body is considered a container for possession. So if an officer is able to determine that someone is under the influence of alcohol or marijuana, that would be sufficient grounds for them to receive a citation and have to go to court for possession of either of those substances. Nuisance parties typically apply to folks who are living off campus. If they host a party that is disrupting the neighborhood, as they will issue citations there and refer that to our office as well to look into. And many times, if your student, even if they aren't living off campus and they attend a party, they can also get a minor in possession ticket if they've been attending the party and the police arrive. We do receive a number of referrals for fake IDs. This is one of the things that the city of Boulder is somewhat unique in that they're especially strict around turning over fake IDs to Boulder Police. Many liquor stores and bars will actually pay their employees bonuses for confiscating fake IDs and turning them over to the police, and those ultimately get referred to us in the court system. And so I think that's important for students to consider if they do choose to purchase or have in possession of a fake ID. And then lastly, something that's new is we are receiving reports on public health order violations. So even in the case, let's say someone receives a minor in possession of alcohol ticket, if this was in the context of them not wearing a mask when they should have been wearing a mask while they're off campus, we are receiving information about that, and we would sort of meet with the student to discuss both concerns, the alcohol and the violation of the public health order. I just want to talk about campus safety because the circumstances on the right, so selling drugs or alcohol, being involved in a physical assault or a fight, threats of physical violence, possession of weapons on campus, those are situations in which we would normally put in what's called sort of interim measures, where if they were roommates, we would separate people or issue no contact orders so that we can put in sort of restrictions to keep folks safe while we sort of look into what happened. And many times some of our most serious sanctions for these incidents will be what occurs. So many times these can result in a suspension or a termination of a housing contract if someone is found responsible for any of those violations on the right. I think particularly when it comes to physical assaults or fights, that's why we have a conflict resolution wing, right? Because many times those will occur when there's underlying conflict that's been unaddressed between individuals. And so Bree, can we jump to the next slide to talk about conflict resolution? And again, this is such an important arm of our office because for us, we see conflict as natural in any relationship, be it between roommates, between friends, between students and faculty. Conflict is natural in a relationship, but learning how to manage conflict is a skill that many people need to learn. And we want to be here to help students learn how to better manage conflict. That is an important skill while they're here. That is an important life and professional skill because again, conflict is going to happen. That can take the form of conflict coaching. So if your student has a conflict and they're like, how do I bring this up with my roommate? How do I want to approach this? How do I prepare myself to listen to the person that I'm going to have this conversation with? That conflict coaching service is available and it is free of charge. That we want folks to come in and utilize that service to help with managing conflict before it arises to a point of physical assault or a threat, right? We also have trained mediators in our office who can then also facilitate mediated dialogues between students and other parties as well, if it's something where folks want to have someone present that can help facilitate that conversation. And again, this is so crucial to the work that we do because we do want folks to be able to productively manage and engage in dialogue and conflict, and we want to be here to help provide the support needed for folks to do that. So with that is what I have for today. I'll pass it back to Bree.
Thank you so much, Daniel. So at this time, Lizzie and I are going to facilitate some of the popular questions from the Q&A that Leisha or Daniel can answer. That would be good common questions that we're seeing. The rest of the new student and family program staff will be helping to try to answer any of those individual questions in the Q&A as well. So I'm thinking the one question that I see needs a little bit more clarification is around the COVID testing. And I know some people were joining in a little bit later, but for our on-campus students, Leisha, can you speak again to the COVID testing a little bit?
Sure, Bree. I will do my best. So the campus has asked for students to be tested 5 days prior to campus arrival. The I've been seeing all the comments and the Q&A about the length of time that it's taking for getting test results back. We would really like students to be able to show that they've been tested, and understanding that testing is taking a while to get back. Even the tests that we've been running in the clinic have been taking a while to get back. We've been using an outside laboratory for that. We're transitioning to doing the tests internally and making them available on campus. We have to go through the testing process, the validation process yet, to make sure that our testing equipment is accurate. One of the things that we'll be doing on campus is we'll start out with the antigen testing and then also offer the PCR test. Our hope is to have everything up and validated and running by the time students are coming back from move-in. I know that people are asking a lot of specific questions related to move-in and what happens. We are working on sending out additional information about what that testing can look like on campus and what will be available, as well as some resources for testing at home. I know that's not specific answers that a lot of folks are asking for, but we will be, and I think, for example, one of the things that I can think about in terms of the limited testing is we're hoping to be able to do 200 to 300 tests per day. That also is dependent on the supplies that are available for testing and the available reagent. I think you've probably seen in the paper that part of it, or in different media, that part of the reason test results are taking so long has to do with the availability of the testing materials and some of those type of issues.
Thank you so much. Oh, go ahead, Leisha.
No, good. You know, I think that the only other thing I can say is that there will be a limited number of PCR and rapid tests available on campus for resident hall students prior to check-in, but we will be providing more information about that shortly.
Thank you so much, Leisha. And I do want to say, for some of the specific housing questions regarding move-in, roommates, and other housing specific questions, we are hosting 2 housing webinars next week, one for on-campus students and one for off-campus students. And currently we are working on a wait list for the on-campus housing webinar. The first registration link is full, so you can email our office here at this families@colorado.edu, and we'll put your email on the on-campus housing webinar waitlist, because we'll be opening up another webinar for that group, since we saw an overwhelming number of families interested in some on-campus housing information. So email us and we can get you added once we have another webinar date.
Thank you, Bree. Yes, do tune in. Let us know if you weren't able to sign up for one of those, as Bree said. I do see a couple questions, and these are very timely as we're having those next week, but there are some questions on renter's insurance as well as some of the other kind of nuts and bolts. I do see from the website, just since a few of you asked about renter's insurance, CU Boulder, it looks like the housing page is not recommending any particular service. It actually says in here, you can find a list of rental insurance providers online by doing an internet search for renter's insurance. So if you have a company that you already use and that you trust, it may be possible to add that on for your student if that's what you wish to do, as well as there are a lot of local folks that could help you out, but there's no particular service that is recommended. And I'm seeing a quick question about this presentation. We have recorded this whole thing, and we'll be just adding some captions so that anyone can tune in and be able to get those captions if they need. So that takes us a couple days, but then we will be posting this to our website, and it'll be available for you to share or view again whenever you wish.
Great, thank you so much, Lizzie. I also was seeing a few questions related to events that will be going on campus. And just since that is our office, new student and family programs, we host orientation and week of welcome type events. You can find that all on our website on our fall welcome tab. So that will be updated later in August. It already has some updates, but the final schedules will be announced. So go ahead and go to our website, and on the Fall Welcome tab, you'll see some of the options and opportunities that will be available for your new student after they move in. I also saw a few questions about Buff One cards, and I do not know the exact time that those are being mailed out, so I just wanted to refer folks to our Buff One card office, their phone number and email. I'm sure our student staff and other staff will be able to link to you as well to get you connected with our Buff One card office.
Bree, can I add something? There was a question about medical visits and insurance.
Absolutely, please do.
So I just wanted to share with you all, if you have questions about insurance, I posted the link to the private insurance billing page. If for those of you who plan on keeping your student under your insurance. I also wanted to let you know that in terms of testing as well, the Buff Gold insurance will cover the cost of testing for students who are tested, and this, I mean, is testing in the clinic because they're not feeling well as part of a medical visit. The clinic will bill private insurance, and then there's a Buff Care supplement that it will cover the cost of that in certain circumstances if your private insurance doesn't. And when I say in certain circumstances, if your student is being tested for surveillance purposes as opposed to they're not feeling well and they're showing some symptoms.
Thank you, Leisha, and thank you for posting that as well. Leisha or Daniel, if you do see any questions that you have something that would be particularly helpful to add, please feel free.
This is Lizzie again. I do just want to let folks know that we also use these times to really gather what is on the forefront of parent and family members' minds, what are issues that we're seeing with what we announce. And so I appreciate everybody putting in their questions about testing questions and concerns, because we do want to continue to build out our own FAQ pages, and we want to, when we're seeing issues, we want to be able to problem solve and find answers. So I do just want to let you all know, if some of it still seems vague, we're still working to provide you even better answers as we can formulate more solutions to those problems.
And I've got back to it, and I know that there's still a lot of questions about testing, and there's some confusion about the requirements for testing. And I would ask you to be patient. We are still finalizing all of our processes related to testing, and we'll get you information regarding testing, when testing will be available for the rapid test on campus, and all of that information as soon as we can. We're just really trying to make sure that the process we have in place will work really well for our community.
Thank you so much, Leisha. I am going to go ahead and launch our exit poll just as we are getting close to the conclusion. We have about 5 or 10 minutes left of our webinar this morning, but I see some folks are dropping off the webinar. So before you go, we'd love to hear if this webinar helped provide you some helpful information about the updates to health and wellness. Did it provide you updates to the Student Code of Conduct? Do you feel like you can be a partner with your student in talking to them about these things? And do you feel connected to CU Boulder and or the new Student and Family Programs Office? Please continue to stay connected with us. We also are helping support some of our transfer students with registration today. So our phone lines and emails might be a bit busier today, but we will be catching up on all of those emails this afternoon, and we'll be available tomorrow as well. So please feel free to give us a call or email. Our Journey Leader mentors are these enthusiastic students in this photo. That's CU Boulder's version of an orientation leader. So these Journey Leader mentors are staffing our phones, live chat, texting, and emails with support from us in our office. So we are there to help you along every step of the way. And like I said, we have more webinars coming up. There's another one on August 6th that will be recorded as well. And that one's about fall welcome and move-in. And then seeing again the alarming response about housing and move-in, we will continue to provide more webinars as we are able over these next couple of weeks as we get you geared up for move-in and fall welcome.
Thanks, Bree.
And then, yeah, of course.
Yeah, I'm seeing a couple questions here at the bottom about the Thanksgiving break and what the rationale was there, as well as when to return in January. So the thought being, we do have a couple days off around that Thanksgiving holiday. Traditionally, students do, they'll often either go home or go visit, vacation somewhere during that time. And so the thought was if we send everybody away, there's a lot more potential. It's just a greater risk as then that many students return to campus, both our new and returning students. So at that point, it made sense from a risk management perspective to just allow students to go on back to wherever they need to be. We will, of course, be working with students, particularly international students who may need to, don't have another option or somewhere else to go during that break. And so they can work directly with Residence Life to get that set up for the break. And then so far as we know, nothing different has been announced for spring yet. I know that we'll be working on those plans as we get closer to the day. But at this point, classes are still scheduled to resume that second week in January. But of course, more would come on that as we continue through the fall. Students, though, they can pack up and take whatever they need for the break, their belongings. They'll return to the same room when we do return if we're able in the spring. And so their belongings could stay in that room over the break.
Thank you so much, Lizzie. And then I just wanted to give any final comments to Leisha or Daniel or Amber, who's joining this call, anyone else from New Student and Family Programs. We'll continue to answer some Q&A typing for a few more minutes, but wanted to open up the floor one more time for any final announcements.
I would just like to thank everybody for being on this call and being on this webinar today. I think it's really important. And I also wanted to thank you all for being patient with us as we finalize our processes and what these will look like for students.
Thank you so much, Leisha and Daniel, for joining us today. Please stay connected. We are very appreciative of all of the families who logged on today to either type a question in the Q&A or tune in just to listen and absorb some of this information. Stay connected, and we hope to connect with you more soon.